All right, so this is the first of 3 of these FMS locations. FMS in a federal standpoint stands for Federal Medical Station, and often when they're rolled out, they come with a lot more federal support than we got here in New Jersey for this particular situation. But the reason for that is they envision rolling these out for situations like hurricanes and other natural disasters that are just going to affect kind of one geographic area, not the entire nation at once. So they have rolled out all of their support that went along with it. So we're opening this up basically just as a state location. So we're calling it a field medical location, or field medical station. So we keep the FMS acronym, but they're New Jersey Field Medical Stations. And it's important to realize that because they're not hospitals. I know some people are referring to them as hospitals and sometimes just have it, and I do it sometimes too. It's not a hospital. They don't have the level of care here for a hospital. It's really just a medical station, low acuity, low level of care here. When you come in those front doors, the registration is not just for today. That's the only way into this place, and anybody that comes into this place is going to be registered to include staff, visitors, anybody except the patients. And I'll show you where the patients are going to come in a moment. All the patients that come here come from hospitals. It's not a walk-up facility. It's not a urgent care location. You will only be transferred here from another hospital when you're at a point where you can be serviced by the level of care here, and then you'll be discharged from here. So just wanted to get that out because that's kind of important. I said visitors. The patients here will not be allowed to have visitors as much as family members go, let's say. But if press was coming in, or if the governor wanted to come back in here, those types of visitors, everybody has to come through those doors and get back.
Before you go on this one.
Absolutely.
Yeah, sorry. When you say the patients come from hospitals, these are patients who are on like recovery from a COVID thing or from more non-COVID?
Non-COVID. So this is all 3 locations right now. The plan is for them to be non-COVID. Now, obviously, COVID could get in here if it gets past the screening or whatnot, but non-COVID is what the goal is. It's meant for those individuals that don't need to be in a hospital anymore because of the level of care that they're receiving, but they are in a hospital because they can't go home. Or if they did go home, they'd have to have like a stay-at-home nurse there, which is expensive. Insurance doesn't pay for that. So if you think of somebody that maybe had a bad infection, maybe they got a really bad cut, it's opened up, it's got a little bit of infection, and they're on an antibacterial IV drip, they don't necessarily need to be taking up a bed in a hospital, but they need to have that IV changed out every now and then, and the dressing change and stuff. That type of stuff can be done here, really low acuity stuff. They're actually, the criteria right now is that they would be discharged in less than 7 days of being here. So they're within a week of being discharged from the hospital. Under normal surge conditions or non-surge, they'd not be a problem in those beds in the hospital. But as you can see, we're running out of beds in these hospitals. So if we can get these types of patients out, it makes room for those that really need to be in a hospital.
Is there a specific designation as far as geography and more hospitals that will be coming here?
That plan is still being figured out right now. We tried to open, I say we, the state, when they planned this geographically. So this is the first location. The second one is a little bit further south in Edison, and the third one's down in Atlantic City. But there's no preclusion right now that I understand that they couldn't take somebody from a southern New Jersey hospital and bring them up here. I just think that there's going to be enough people in this geographic area that they'll pull from the hospitals around here first, just logistically, and then when it comes to discharging them, it's just easier to get them home. But right now, that plan is still being developed.
Can you say and spell your name?
My last name is, well, first name is Marc, M-A-R-C. Last name is Pellegrino, P-E-L-L-E-G-R-I-N-O.
And your title?
Sergeant First Class.
Thanks.
You said about discharging and going through hospitals, will they be discharged straight from here or do they have to go back to the hospital?
The plan is to discharge them straight from here. Yeah, that's the plan. So again, this is all stuff that the Department of Health at high level is trying to figure out, and a lot of it has to do with maybe needing some changes to waivers and whatnot. That's kind of beyond my comprehension, to be honest with you. But yeah, the idea is they get discharged from whatever hospital system we're in, get brought here, and then discharged out of here to home. That's the plan.
Thank you. Thank you.
People got on that first tour. Oh, that guy Tim, right? Yeah, was he hanging out? So, I mean, obviously, a week ago, this place was just a wide open convention center, like anybody's seen who's attended any kind of convention. hard slab floor, wide open, a couple of pillars here and there, and then the walls on the outside. So this is the type of facility that the federal medical stations are intended to be placed in. Already, mortar, walls, and roof over your head. So what we did was we actually visited the Jacob Javits Center to see how they were setting theirs up, because New York was a couple days ahead of our initiative. So we went there with the general manager of this location. His name is Frank, and he went over there, and his perspective was really it's just like setting up any other trade show with 10 by 10 stalls, except instead of having some sort of vendor or whatever it is at the trade show, it's patients in beds. So he said, I've got this, no problem. Ordered all the stuff that you can see, the walls, the drapes, the metal. That's not part of the FMS cache, and he put this up. If you want, there's a room that's staged here. If you want to just see what the rooms are going to look like, really not much to them, right? It's a bed, a chair for the nurse or doctor to sit in when they're talking to you, a wastebasket, and that's basically all you get from the FMS cache from the federal government. So the Department of Health here in New Jersey has identified some other things that they might want to put in these rooms. For example, a tray for the patient to eat off of or to receive their medications on. If you see what you normally have in a hospital, at least there's some sort of tray that you can put on your lap or your bed or roll in there. So those items have been ordered and they'll be in at another time.
And what's the bathroom situation?
I'll kind of show you. So I actually don't know the exact number of pod counts that are in here, but it's 250 beds, 250 rooms / 250 beds, because there's one bed per room. If we needed to increase the capacity of this place, you could put 2 beds in a room if they were family members. So that is a possibility. It's 250 rooms, yes. 250 rooms, 250 beds. Right now, 1 bed per every room. If we had 2 family members that came in here and they didn't mind being in the same room, privacy, all that stuff, we could obviously increase the number of beds a little bit. The next location, which is in Edison, is a 500-bed facility, and then the Atlantic City one will be 250, like this.
Is there a number for how many medical staff will be here?
Yeah, still being formulated, so I'll give you a draft rough numbers. It's about 260 that need to be brought in. And on any given day working here during a day shift is somewhere around 90, and then a night shift is somewhere around 60. So I know 90 plus 60 doesn't equal to 200. It's because people can't work 7 days straight, right? So they might work Monday, Tuesday, Wednesday, take Thursday and Friday off, and then those people that were off would come in and work those days. So.
And who's going to staff it?
Again, still to be determined, but it'll be a combination, a blended model of volunteers, of contracted staff. There's vendors out there. There's nurses and doctors that are unfortunately out of work right now because of everything that's going on. So bringing in some of them in, as well as the New Jersey National Guard, and possibly some federal assets as well. So, sinks, obviously, sanitation, hygiene, important things that this place normally doesn't have for a trade show. So they had to get a little clever on some of this stuff. This thing has a built-in hot water heater, so you do have the hot water that you need to make sure that your hands are getting clean when you clean them up. There's a 5-gallon bucket underneath it, actually, that needs to get emptied probably on a very regular basis. So the cleaning crew that's going to be in this place will come around and do a cycle and empty those buckets, but this way at least when a nurse or doctor comes out of working with a patient, they can clean their hands. So these things are sporadically placed around, as you can see. There's also some hand washing stations that don't quite have the hot water and stuff, and they can show you them as well. You can see we have not only red waste, which is the bio waste, but regular waste, and contract services are set up to draw out the bio waste, and linen service. And there's another room set up here with a slightly different style bed in it.
Is there a particular reason, or just what they had?
Yeah, so there are some, I guess if you have more medical issues, you would be in one of these beds that's higher, easier for the nurses to work on you on. As you can see, the mattress is a little bit thicker, probably a little bit more comfortable. And then as you're closer to getting out of here, the less acute issues you'd be put in the cots that aren't as comfortable, I guess. So the starting process was actually done kind of before our team got in place. There was a large group, U.S. Army Corps of Engineers and other NJSP and NJOEM folk and Department of Health folk that were involved in the identification of locations. So if you go back that far, it's weeks, right? To go around the state, take a look at the facilities that we have in the state that are open and available to do this. But when we officially got turned on as a team and given the orders to get it up and running, this place is about a week ago now. So what you're seeing right now, what is today? I don't see those track of days. Thursday? Today would be the 6th day. So and tomorrow is when we expect it to be basically 100% done from a build-out perspective. So 1 week from start to finish on breaking ground and getting it built out. At the same time, we've been working on the staffing, and at the same time, we've been working on the supply chain. There has to be a supply chain behind this because we need to go through medical supplies, PPE, and all that. So all that stuff he's been working on together. We have some of the staffing coming in as early as Saturday and Sunday, and Monday is the goal right now for a soft opening. I don't know if we're using the word soft opening, but maybe bringing our first patients in, hopefully on Monday, just a few at a time to make sure that the processes here are up and running before we fill it up with 250 folks, right? So that's the goal right now. Not sticking to it. The governor did say before that he hopes it's early next week, so that is our goal to be Monday. Not going to go much further past this. It's still a work area, okay? But that door right there is where the ambulance will be the patients in and where they'd be picked up. Somebody asked before about the bathrooms and showers. As you can see, that's a shower trailer right there with 4 shower stalls that needed to be brought in here so that the patients can shower. And this setup right here is actually an ADA compliant shower. There was no ADA compliant showers available via these trailers, or they were ridiculously expensive. It's a shame that in this type of environment nationally, when we're reaching out to vendors to find some of the supplies for these things, that they seem to be jacking up the prices, which you've seen in the news, right? So they said we have 1 floor drain in this place. We can just build an ADA compliant shower over it. So that's the floor drain in the ground, and there's an ADA compliant shower in there that they can wheel somebody in, have privacy, and help get them into a shower and help them get clean if they're in need of that. There's a pharmacy that's going to be back here, behind these walls. There's a pharmacy, obviously under lock and key. And there's a pharmacist group that's going to be here to run the pharmacy, and food services come out of here as well, not only for the staff but the patients as well.
So you think some of the price gouging some of the companies and vendors?
I don't know if I'd use the word price gouging, but certainly higher than some of the other vendors that came in. So it could be that their cost of operations is higher. It could be that they were coming from Florida and the travel time is higher, but certainly higher prices and lower prices. So to keep the price down for the state, the state's paying for this, so tax payers and everything, we've tried to go with the lowest contract prices we can find, and in this instance it meant building an ADA compliant shower ourselves.
I'm sorry, I don't know the nursery this is. This privately owned building?
It is privately owned, yes. All right, we'll go around this way. I'll show you a nurse's station, and then we'll kind of wrap it up. Bathroom. There's 2 sets of bathrooms in the building that look just like this. One's on this corner, one's on that corner. We're designating one on that corner to be a staff-only bathroom, just so they kind of have their own bathroom. This one will be used for the patients. However, each one of them only has 1 ADA compliant stall in it, 1 men's, 1 women's. So we have porta-johns and trailers that are being brought in that are ADA compliant, and then also just to increase the total number of bathrooms in the place. Those bathrooms are, some of them are outside. They'll be brought in when this is all cleaned up. Here's a nurse's station. Daisy, you're going to start doing these. You're going to start doing these. This is a nurse's station. There's 4 of them in this facility. So the ratio, 250 beds to 4 nursing stations, but it was also, square footage, what we could fit in here. Would they have liked another nursing station? Probably, but they're even spaced close to all the rooms. The next location, which is Edison, the rough floor plan for those 500 beds. Originally, they had spec'd out like over 20 nursing stations. Working with Department of Health, we cut that down to I think around a number of 14 right now. But that place is a much larger facility. And if you guys are going to do this again for the next location, you'll see that. Much larger facility.
Of those staffing estimates you told us before, roughly what percentage are going to be nurses and what are doctors?
Off the top of my head, I think there was about 6 doctors on day shift, 4 doctors on night shift, and then maybe something like 19 or 20 nurses on a day shift and maybe 12 on a night shift. Rough, I'm going off the top of my head.
Do you know what the budget is for this operation?
No, I don't.
What was that again, the staffing?
Roughly, 6 doctors on during the day, 4 on at night, and then somewhere around 16 nurses or 19 nurses daytime and 12 nighttime, something like that. But we actually have those numbers. If you really want those numbers, we can get them for you at the end. That's off the top of my head. There's a lot of numbers in there. Some of these ones with the black curtains are just used for storage. As you can see, this is one of the medical supply cabinets for the non. What's that?
Can we get closer to it?
Sure, absolutely. Those are for the non-controlled substances. The controlled substances are in the pharmacy under a heavier lock and key. Access into this will be a code. There will be a passcode, and then obviously they type in the door that they need opened up, and then they scan it so we know how much of the substance came out of there. Typically that you see in any doctor's office. One of the challenges in this place is that all the electrical, it's an older building, it's an older convention center. All of the electric and plumbing is in the ceiling. So everything that they do, they have to bring down. So that's why you see these sinks, and I told you they have the bucket underneath. There's no drainage underneath here. So they would have had to pump that stuff up. And again, we did get quotes to do that. From a cost perspective, it was cheaper to have it set up like this and hire the cleaning crew to come and basically empty those buckets out than it would have been to build an entire plumbing system and pumps on those things to get all that stuff out of here. So
I know you mentioned some of the staffing. I heard you talking about some of the doctors and the nurses. Like how much just to keep the physical, like how many people are you gonna have going around changing buckets and stuff?
I don't have a number on that off the top of my head, but it's you know, your typical cleaning crew that's just going around mopping up and stuff. Garbages, bathrooms is just going to be part of that activity. And then there's another service that's going to come in because of the bio cleanup. If there was linens with blood stains on and stuff, that has to be handled a bit differently. And the typical cleaning crew that they have here isn't equipped to handle that.
The red trash can stuff.
The reds, yes.
Can you address power? I know you touched on it. Do you need more power than normal?
Nope. No more power. This place had plenty of power, but we do have a generator here that was brought in that they'd never had before. It's rented. They didn't buy it. It's rented to supply emergency backup power. So every piece of power that's in here, if there was to be an issue with the loss of the line power, within 30 seconds the generator kicks on and the whole place is powered back up. So that was in addition for this particular instance. Again, some of the stuff behind the black curtains is just supplies. Limited square footage here. We had to do what we could with it. So this area behind these doors is normally part of the lobby, but it's been sectioned off. You probably didn't even notice it when you walked in the doors, but to the left there's some black curtain up. We needed to carve out an area for the staff to have a break. The doctors, nurses, anybody that's working here when they're eating their meals or just, it's break time. So this area in here, you can probably see there's some, coffee stations set up and there's tables and chairs. And then right through there's a little closet that's going to be used to store some additional medical supplies that need to be behind lock and key. So it's locked storage back there. And again, I'm just kind of showing you limited square footage here, the space that we had to work with. Behind these walls, I'm going to take you in there for a moment. This is where the New Jersey All Hazards Incident Management Team, which is a team, sort of state resource that is managed and administered by the state police, New Jersey Office of Emergency Management. that we were the team that got called in to get this set up. They've been working out of here. We've been working out of here.
From the state point of view is that this is for non-COVID patients, and that I think we're going to have to spend a little time getting organized and taking a smaller number of patients and making sure that everything's working correctly. Because keep in mind that most of the staff who's coming into this place comes in over the next several days and is going to receive orientation and training. And the goal would really be that to ramp up rapidly to be able to take a full 250 patients during the week. So that's what we're working on. And we're getting great support from the state police, we're getting great support from the National Guard people out there, the facility people here in terms of the build out. Most of this stuff doesn't sound like it existed before Sunday of last week in terms of physically building it. So everything you're seeing has really been built in the last 4 or 5 days. So we're now trying to then make this into a kind of low level for lower acuity patients and see if we can, in getting all the equipment set up to take care of people who would normally be in a hospital but wouldn't require intensive services. So that's what we're working on.
How are you guys going to be taking care of yourselves emotionally during all of this and protecting yourselves from getting sick? Well, even though there aren't any COVID patients here, you have to assume at some point or another someone will have COVID that comes in that door.
And that's
Correct.
exactly the case. We are going to be treating it as if, everybody in here. So all staff, from the time they come in, will definitely be wearing these masks, and anybody that comes in contact with a respiratory type illness will have the N95 mask at this stage of the game.
So we're going to be reproducing a lot of what hospitals have had to be inventing and producing right now in terms of how to, use PPE and everything else. And our priority, I think, the advantage is we will have learned a lot from what the hospitals have had to face over the last 3 or 4 weeks. We're talking to a lot of our colleagues about how they're handling even low-risk patients. But we're really going to assume that anybody who enters this facility as a patient is a low-risk patient to us or more. And they're going to, take care of them appropriately, but also from safety. And really, as staff comes in, training and an orientation to personal protective equipment and everything else is going to be key.
All right, so we have to keep moving, and they're opening up the upstairs. Everybody wants to get a visual.
My first name is David. My last name is
Get the
Adenaro.
perspective, and then we
I'm the
have
Chief
to.
Medical Officer for this site.
Titles, can you
My
just
name is
repeat that
Patty
again,
Drapick,
please?
and I'm the CNO.
Where you're from?
Secaucus.
Sure.
Chief Nursing Officer?
My name is Dr. David Adenaro. I'm an emergency physician by training, and I have been hired to be the Chief Medical Officer of this FMS.
Can you spell your name?
Adenaro is A-D-I-N-A-R-O.
And you said David?
David, yes.
And you came from a particular hospital?
Previously, I'd worked at St. Joseph Healthcare System, but I actually was transitioning to another job when they offered me the opportunity to do this for the next several months.
And where are you from, sir?
I live in Florham Park.
Thank you.
And nurse manager?
I am Patty Drapick. I'm actually the Chief Nursing Officer for the site here. I too, have worked at both St. Joe's and St. Barnabas systems in my past, and took this job to basically see what we could do to make a difference.
Can you spell your name?
Sure. It's Drapick, D-R-A-B as in boy, I-K, and
your
first name
first
is Patty.
P-A-T-T-Y?
I.
Hi. And your exact title?
Chief Nursing Officer, and Site Director is the full title.
Thank you.
Patricia Vincent, nurse manager here at FMS Secaucus. By way of Robert Wood Johnson, cardiothoracic experience, DCPMP experience, as well as outpatient experience with the population, pediatrics and adults.
Where were you most recently?
I was most recently with Summit Medical Group most recently.
Thank you. Can you just say where you're from? What town?
I am from Roselle, New Jersey.
And I'm from Boonton Township.
Thank you.